Today we'll study about convulsive disorder. It is a group of symptoms which appears when brain is damaged or the neurons are damaged. Here what happens, abnormal discharge of positive neurotransmitters, discharge from left hemisphere or left or right, both hemispheres. It is characterized by abnormal jerky movements or flickering of eyes, um, or abnormal loss of muscle tone. For units, if the unit have an accident, if the child have any accidents or they have any birth injury or any metabolic disorder like hypoglycemia, if he suffer from electrolytes altered level of electrolytes like hypocalcemia, hypomagnesemia, hypernatremia or hyponatremia. If he suffer from if Ray syndrome appears, then the baby or the child of any age group can suffer from convulsions. It is of two types: partial convulsion and complex and generalized convulsion. Partial convulsion is of two types: and simple convulsion and complex convulsion. So in convulsion, patient is in partial convulsion, patient is conscious, and in general convulsion, patient is unconscious. In simple convulsion, in partial convulsion, partial part of brain, that is left hemisphere, is damaged. That means the left hemisphere of brain, in case of partial hemisphere, discharge maximum amount of positive neurotransmitters without control, and it happens jerky movements or abnormal flickering of hands and legs or muscle loss of muscle tone. In simple type, the patient is conscious, and in complex type, patient is unconscious. And in generalized convulsion, it is of many it can be divided many times in many types. First of all, tonic seizure. Here the tone of muscle is lost. In clonic, the jitteriness or jerky movements like this is happens. And in um, tonic clonic, both jitteriness appears as well as muscle tone is lost. Next, myoclonic seizure. Here, muscle tone is lost. Jerky movements can be happen, but the patient is not conscious, not unconscious. He is conscious and he can think freely by himself or herself. In tonic-clonic seizure, the patient is jerky movements is found in patients, and he lost his muscle tone also, but the patient here is unconscious. Next, come to the pathophysiology. First of all, from left hemisphere or both of the hemispheres of brain discharge abnormally high discharge high amount of positive neurotransmitters abnormally, and it causes convulsion, and then muscle become weak, and which results in convulsion. Next, come to the risk factors. Here, any type of risk in head injury or accidents. Next, medical management. If a patient is having convulsion, then for neonates, first check his temperature, his breathing capacity, that is if he is breathing properly or not. If it is not, then give him proper position, or help him in breathing. If he is unable to breathe, give give him give him provide ventilation to him. Then check his glucose level in blood. If it is greater than 45 degree, then uh, administer 10% calcium gluconate for 5 to 10 minutes. If it is less than 45 milligram per deciliter, then start administering phenobarbital, that is 20 mg per gram for 15 to 20 for 20 minutes. If the patient is not recovering his seizure or convulsion, then start more 5 mg phenobarbital per kg for 5 to 10 minutes. Then also then check it, then assess this the situation of the patient for 30 minutes. If he does not cure, then go for phenytoin, and if he cure, stop phenobarbital and assess him for 48 hours. Next, nursing management. First of all, we have to protect the patient from any risk of injury. It is the golden point. Help him in respiratory, if he got respiratory problems. Next, help him feeding. If he can't take orally, take food. We know in case of convulsion, patients often is unable to take food orally. Then we have to insert nasogastric tube to feed him. Teach patient's mother or the patient party how to care for NG tube, or how to feed the baby by NG tube. Hope you will understand that topic.